Good morning, I'm Ivan Hernandez, and today I'd like to present an overview of rheumatoid arthritis, of chronic system autoimmune disease that primarily targets synovial joints, but also has far recurring effects beyond the musculoskeletal system. Rheumatoid arthritis is more than just pain. It's a chronic inflammatory disorder that can affect many tissues and organs, not only the joints. It's autoimmune in nature, meaning its body immune system mistakenly attacks these own tissues. The systematic aspect of rheumatoid arthritis means it can involve organs like the lungs, heart, eyes, and even blood vessels. Early identification is critical for effective management. And now, rheumatoid arthritis. Rheumatoid arthritis is more than just pain. It's a chronic inflammatory and disorder that can affect many tissues and organs. Yeah. The next is pathophysiology. And the pathophysiology, rheumatoid arthritis, or RA, involves autoimmune response where the body's immune system attacks the synovial membrane. This triggers chronic inflammation, leading to pannus membrane or pannus formation, a tegnated layer granulation tissue, which erodes cartilage and bone. Over time, joint destruction and deformity occur. Key mediators include pro-inflammatory cytokines like TNF-alpha and interleukin-6, which are also therapeutic targets. In RA, or rheumatoid arthritis, the synovium in the membrane leading to joints becomes inflamed. The immune system produces auto-antibodies that attack this membrane, leading into persistent inflammation. This inflammation results in the formation of pannus, in an abnormal layer of tissue that invades of destroys cartilage and bone. The next, clinical presentation of clinical features. Patients typically present with symmetrical joint pain, morning stiffness lasting over an hour, and swelling in small joints, especially that the hand, wrist, and feet. And this is imagined. As the disease progresses, the former lacks ulnar debilitation of swan neck fingers may develop systematic symptoms such as fatigue, low grade fever, and weight loss are so common. The next, diagnosis. The diagnosis is very, very important. That diagnosis is based of clinical findings and supported by labs. Rheumatoid factor RF and anticyclic circulated peptide and anti-CCP antibodies are useful markers. Elevated and ESR and CR protein and the sigils reflect on joint inflammation. Imagine particularly ultrasound or MRI can detect early joint damage before it's visible, or X-ray. Diagnosis is based on a clinical criteria, SR, ULRI classification are supported by rheumatoid factor and anti-CCP or RC protein, and agree inflammatory markers use the SRR or CR protein. Yeah. The next is the treatment. The treatment goals include reduce inflammation, prevent joint damage, and preserving functions. First line therapy involves designs modified anti-rheumatic drugs such as methotrexate, and refractory cases, biologic agents like TNF inhibitors are used. Early intervention significantly improves prognosis. Treatment is multifaceted. that and should start early to prevent irreversible damage. Main that treatment options of conventional DMARDs that like methotrexate, sulfalizine, hydroxychloroquine, or lefunemide, biologics that TNF inhibitors or etanercept or adalimumab, etc. Thank you very much. You listening me are this pathology very very important. That rheumatoid arthritis. Thank you.